Well, there are some big developments coming out of this year's Alzheimer's Association International Conference, including the results of a study on a new blood test that could diagnose the disease and the major impacts of wildfire smoke, which we're starting to see here in Western New York, on your brain health. Joining us now to talk about this is Chelsea Torgalski. She's the Education Program Manager for the Western New York chapter of the Alzheimer's Association. Chelsea, thanks for being here.
No problem. Thanks for having me again, Dave.
All right, so we actually, and you folks have been here a year ago when this conference was happening and other developments were coming out, and then we continued to talk about them throughout the year. So this is good news, more good news coming out of this conference. Let's talk about the two major developments.
Absolutely. So one of the biggest developments that has come out in the form of multiple studies is the development of a blood test to identify if someone has Alzheimer's disease. So having a blood test readily available would increase the availability of getting a diagnosis for a lot of people. It's expensive, it's sometimes not accessible for a lot of people, but also it'll decrease the wait time where people are getting that diagnosis. And on top of that, it can help identify people for clinical trials, other clinical trials in the future that will help solve other problems that we're looking at.
So how is the test done now? I mean, to go from whatever you're about to say to a blood test seems like a very significant development.
It is a very significant development. Currently, physicians are utilizing medical history, tests like taking spinal fluid, PET images, and really kind of ruling out anything else that could be causing this memory loss. So for someone who already might have a memory impairment, those appointments, those tests can be exhausting and quite grueling. So having a blood test that's one simple, non-invasive, really, for the most part, test is a game changer in the forefront and looking at the landscape of Alzheimer's disease moving forward.
So let's talk about where this is in the process. This is just now being talked about at this conference.
Yes.
And obviously, studies have shown that it is effective. What are the next steps? I mean, has the FDA already started to sign off on this? Are they going to get their advisory panels together? What are the next steps?
That is the big hope.
Yeah.
So we're looking at some very successful studies that are coming out, and that's the first step for the most part. So looking at those, seeing how successful they've been, we're hoping to see them push forward in the near future.
Do you know if they're talking now, as they're starting to get this off the ground, if you need any prerequisites for this blood test? Like, will they only test your blood if you have a family history, if you have those plaques building up in your brain and they can tell by a spinal test or something like that? Do you know if this is just available to everyone? So let's say if you're of a certain age, 55, 65, whatever the age is, you can go to your doctor and just get a blood test, right? I mean, that's the idea. It cuts through all of that.
That's the hope.
Yeah.
That's the hope. We're not quite there where they're looking at how they're going to roll these out, but I will say, it's not only going to be for people who have family history or memory concerns, because what we're trying to do is identify people before they're having those memory loss issues, because we know the disease starts changing the brain up to 10 years before we're seeing symptoms on the outside. So not only is it going to be helpful for people who already have memory issues, but we're hoping in the future as well it'll be helpful in identifying people before they're even seeing symptoms.
Which is huge, and that is the key to Alzheimer's and other dementias, is the early diagnosis.
Exactly.
It is critical. And these developments, being that it could be just boiled down to a blood test, is absolutely huge. There's another development that came out of this conference that is a little bit alarming, especially during the warmer months in the United States and in Canada. Scientists are now saying or showing that studies are showing major negative impacts of brain health from wildfire smoke. And again, we are just now starting to get this into our region across Western New York. We have higher than normal rates of Alzheimer's and dementias in Western New York. Tell us a little bit about this connection with wildfire smoke.
Well, one of the things that we know, and that's been in the research for a long time, is there's a very strong connection between your heart, your blood, and your brain. So when you're breathing in toxic fumes or air that's not as of the quality that we would like it to be, that in turn can affect your brain and how the nutrients that your brain needs are traveling to it and everything. So we're excited to see where this development goes and how we can look at it and really better understand how environmental factors affect our brains, because that's a big piece of the research that's coming to a head more.
Chelsea, tell us where folks can find more information in terms of local resources. I also should say I'm a member of the board of directors for the Alzheimer's Association, the Western New York chapter, so very, very honored to serve in that capacity. But if folks wanted to find information, especially if they have a family member or a loved one who might be forgetting some more things, maybe a little bit, maybe they're noticing some changes in their behavior, where do they go?
ALZ.org is our website. That is ALZ.org. There you can find a plethora of resources from what's going on in your Western New York community to what are the warning signs of Alzheimer's. There will also be information about some of the new research that's coming out of our AAIC conference this year. And then we also have a program called Trial Match. So with this program, you can make a free confidential profile online, and you can learn more about what's going on in your area in regards to research, what you might be eligible for, and then you can reach out to the researchers and get more information from them.
All of these resources are free from the Alzheimer's Association. Please take advantage of them if you have some concerns in your life. Chelsea, thank you again for being here.
Thanks for having us, Dave, and thanks for all you do.
Of course.